Meanwhile, the NCDC says it has been closely monitoring several endemic diseases, including Mpox, which has been declared a public health emergency of international/continental concern by both the WHO and the Africa Centers for Disease Control and Prevention. Earlier, I spoke with health expert Dr. Njemande and asked him what factors he thinks are responsible for the alarming spread of Mpox in Nigeria.
Disease spread has several reasons, several contributing factors. Uh, we are constantly, so that means to create areas of living, we have to go into vegetation. In countries like Congo, it's a very big country with a lot of mining areas and covered by vegetation. And of course, animals live there. So these are zoonotic diseases. When you encroach in the animal environment, you will also get animal disease. So that's very simply the observation from time. So it's not really out of place that we should have some resurgence of these diseases when we encroach in the animal space. So in an endemic area like Nigeria, Congo, both West and Central Africa, these are endemic areas for monkeypox. So we know that this disease can occur. Now, the mutations that occur are natural processes. The most of the time the viruses mutate. Some strains are more transmissive than the other strains. So in this case, we might be faced with a more transmissive variant of the virus.
Now, at this point, what measures do you recommend that both federal and state governments implement to curb the spread of Mpox in Nigeria?
Yeah, the urgent measures we should take is, as I said, is public awareness. So we have to start teaching our people on case detection. The best people to do this are the mothers and fathers and the relations at home. When you notice that the child is having fever, headache, and rashes, this is what you do. So pamphlets with pictures of these patients placed in public areas is very, very important. The road transport unions, among them, you put these pictures on their vehicles, and then make sure that the society is sensitized in the churches, in the village meetings, in gatherings. That look at this. If you should find someone in your community, in your village, in your compound, who has these symptoms, now this means that the person might have monkeypox. So you take the person to the hospital. So this sensitization and awareness is helpful for case detection and, of course, isolation that will make sure that this disease, which is spread by contact, just contact with the next person, would actually prevent the spread of this disease. So if we can use general awareness and public education through the press, through television and radio, and also the print media, we could do a lot to curb this disease. The triad or the three symptoms that stick out easily: the person is having fever, is having headache, is having rashes. So if you see such a person, you might have to limit contact. If you see that the person has body fluids, things coming out of the body or the skin, so you have to avoid contact. If it's your child or a relation, you might do well buying gloves to take the person from one place to the other, to clean the person. So by just that contact, in other societies where this disease has spread by sexual contact, men having sex with men, that's a different thing altogether. We don't really have that in Nigeria. But here is basically disease in children, and then the contact is basically for those who are taking care of them.